Hi there, I'm Dr. Rajeev Kapoor. I work as a colorectal surgeon at Fortis Hospital, Mohali. Today, I will talk about the diagnosis of rectal cancer. So, how does it present? Usually, rectal cancer patients will have history of bleeding per rectum. It could be fresh bleed. Sometimes they could pass clots. The other very important symptom not to ignore is that when there is a change in bowel habits. Suppose I go and freshen myself at 6 a.m. every day, every morning, and then all of a sudden I find that my habit of going to the toilet has changed and I may have to go frequently. So there is a change. And that is a very significant symptom. The other symptom could be a painful passing of stools. That could be because of benign causes also, but we cannot ignore it and we should consult a doctor. There could be alternating diarrhea with constipation, and that again is a very important symptom and it should not be ignored. Sometimes patients complain of ill health or loss of appetite or loss of weight, and though these are very non-specific symptoms, these are not symptoms for rectal cancer. They could be a symptom of any malignancy, but these symptoms also should never be ignored. Very rarely a patient can have something coming out of the back passage, and that could be a tumor in the lower end, and that again needs urgent consult with a surgeon. So once we get these symptoms in a patient, we of course will examine the patient clinically, to do a digital examination in the clinic and try to feel that if there's any malignancy in the lower rectum. Now, what is rectum? So rectum is the last part of the intestine or of the large intestine. This is a part which is about 15 to 18 centimeter long, and this is where the stools are stored, and this starts from the back passage upwards for 18 centimeters. Part of it is accessible with a digital examination in the clinic, and the malignancy, if it is in the lower part of the rectum, can be felt clinically. What are the tests required? The confirmatory test, of course, is a colonoscopy. We put in a telescope through the back passage and have a look right across the colon. But yes, if there's a tumor, we take biopsies, and those biopsies will confirm the diagnosis. Other tests which are required are PET-CT, and a PET-CT would actually tell us about the spread of the disease, whether it's confined to the rectum or otherwise. Another important test required is an MRI pelvis. An MRI pelvis gives us a detailed mapping of the rectum and the tumor, and tells us whether the tumor has spread outside the rectal wall or is confined to the rectal wall. All these have a very strong bearing on what treatment will be given to the patient. I will discuss the treatment options in my next video. Have a nice day.